Type 1 diabetes is hard. Every single day there are variables like what you're eating, how active you are, what your emotions are like. Every single one of those variables that change every day affects your blood sugar level. And the problem is a lot of people just put their head in the sand and they don't manage type 1. And that is not a good idea because the complications of type 1 diabetes can be devastating. My name is Dr. Jody Stanislaw, and I myself have had type 1 since I was 7, and I'm now a naturopathic doctor. Through the past 30 years of living with type 1, I have learned things that I truly have never learned from my doctor, that I would have paid thousands of dollars to know when I was a teenager, because if I knew what I know now on how to manage type 1 when I was younger, it truly would have changed my life. How did I get here? Well, as I said, I got diabetes when I was 7. And I was I followed a very strict eating plan. I was told exactly what I could eat at what time. And I remember that week in the hospital, it changed my life. My life has never been the same since my week of diagnosis. And I came out with this eating plan of no sugar, exactly how much food I had to eat at what time every day. And I was a very obedient little girl. I wrote down everything I ate every day. I was allowed 2 things with sugar a week. And at first, it went fine. I was an obedient little girl. I did what I was told. But then it got hard. And I know that everybody with diabetes goes through this. But we give up and we think, I want to rebel. I cannot follow these strict rules anymore. Testing your blood sugar every day, doing multiple injections every single day, worrying about going low and passing out at school or when I slept. And the responsibility of managing type 1 is immense, and I couldn't do it anymore. So I stopped following my food plan. I knew where the cookie jar was at every single friend's house, and I would make sure that I could get some when nobody was looking. And eventually, I was a very clever kid, so I figured out how to sneak sugar. And I did this for years. And eventually in my 20s, I developed an eating disorder, which is very common with type 1 diabetics. And my life took a really big turn for the worse, and I knew I had to do something different. I actually was at a girlfriend's birthday party, and I was literally binging on her birthday cake in the kitchen, and I just started crying, and I knew I needed help. So I went to a 2-month eating disorder rehab center, and from that day on, I knew I had to turn my life around. How to live with diabetes sanely is what I was now on a mission to do. It's not going anywhere. We haven't been cured yet, but I live with this. And for those of you with type 1, I understand. You live with the immense amount of responsibilities of balancing your blood sugar level every single day. Every single day, it demands a different amount of insulin. There are fears. There are fears of blindness. I remember I was afraid of going blind when I was a kid. There are fears of losing a toe, losing a foot. There are fears of heart disease and strokes. There is a lot of risks to not taking care of diabetes. But what I've learned and why I went to med school is that most doctors don't even know how to treat us. They don't. They are not trained how to treat type 1 diabetes. There is so much involved that most doctors don't have the knowledge or the time. And I do. I help patients with type 1 diabetes now. I've dedicated my entire career to helping patients with type 1. I have a virtual practice so I can work with patients anywhere around the globe. And I have knowledge now that I literally would have paid thousands of dollars to know when I was a kid because I figured it out by myself. So I got out of rehab and I thought, how am I going to do this? I tried to find a doctor who understood and I couldn't. And I hear that every day from my patients. My doctor doesn't understand. My doctor doesn't give me enough time. My doctor can't answer my questions. That is so common with type 1 diabetes. It's sad. It's very sad because the complications are severe. I'm here to say I have knowledge that can help you live a happy and healthy life with type 1. I truly, after 30 years of figuring out how to balance my blood sugar level when I exercise, so I can exercise without having to worry about having a low blood sugar. I can not worry about having a low and dying when I go to bed. I can eat small meals. I can eat big meals. And that is what I teach my patients every single day. Not only do I have a happy and healthy life now with type 1, But I have had an amazing life. I have traveled around the world, sometimes by myself, which I know a lot of you with type 1 are told you cannot do. I've lived in 5 countries, I've traveled to 25, and frankly, I'm more fit and healthy now than I have ever been in my life. So the information that I have that is life-changing for type 1s is what I want to share with you. All I ask is that if this intrigues you, to go to your computer and sign up for a free complimentary consultation with me. I would be more than happy to share with you what I've learned. The URL is consultwithdrajody.com/type1 and the number 1. And I'll spell that. So it's consult with and then drjody.com/type1. And you'll be taken to my calendar. You'll sign up you'll see the times that we can have a call. We'll have an intro call. I want to hear about what you're struggling with. I want to hear about what you know about your diabetes and what baffles you. I promise you, I can help you. I do this every day with patients around the world and have so many type 1s that have transformed their life. Better A1C, can work out without having a low blood sugar, and can go to bed without fearing a low. So please, if you have type 1 and you want better care, sign up for a free consultation with me today. I look forward to speaking with you soon.